Hello and welcome back to the Care Plan. My name is Jacqueline Boyd. I'm the owner and founder, and I'm so glad that you've joined us today. At the Care Plan, we provide one-on-one advocacy and consultation services for individuals or families going through health challenges. This week we are going to talk about how to have the hospice conversation. It is rare for people to feel ready to talk about hospice, and even more rare to have all the team members on the same page. In general, it can be confusing to think about adding another medical service to a system that may already be established. It's hard for people to think about, well, I've gone to the same primary care physician for 10, 15 years, and now I'm going to change. Or instead of going out to appointments, I'm going to be cared for at home. Oftentimes, it's not the person who is in need of hospice who's even able to make these decisions. It's the power of attorney or the healthcare proxy or the people around them who are responsible for saying, okay, maybe we should talk about hospice care at this point. The first step is to do your research. Understand what's out there, what's available in your area. Ask your friends and family who had positive experiences with hospice organizations. What did they like? What did they not like? And identify your top 2 to 3 choices. The next step is to talk with team members individually. So if you're confused about what that term means, care team or who's your team, there's other videos on that subject, but basically it means who are the people closest to the person who needs care? Who are the folks who are showing up to assist with the tasks, to help coordinate and make decisions? That's the team. It might be your siblings, it might be your parents if you're taking care of older adults in your family, it might be friends if you're just showing up and taking care of a loved one. But it's important to talk with each of the team members individually to get a read on their feelings about hospice, their experience, and what they believe the person would want. The next step after you've broached the subject with everyone individually is to talk as a team. The best way to do this is to let folks know ahead of time, invite everybody to a sit-down meal so that you can talk in a relaxed environment. Again, preferably in a private home. It's hard to have these kinds of conversations in public spaces. So really try to have this kind of conversation in person in someone's home. If that's not possible, you can absolutely have a phone call or a conference call, even video calling, but it's important to really interact with each other as people and continue to bring the conversation back to who is this person that we're taking care of and what would they want as you're making these decisions. Another step in the process is to keep a list of questions. You may think of things throughout the day or throughout the course of your week that you want to ask the hospice nurse or hospice personnel when you do the intake conversation. So just keep a list of those. I always keep a list of any questions or tasks I have on my phone because I always have it with me. So hopefully something like that might work for you. The next step after you've gotten buy-in from all the team members, you've done your research, is to meet with a hospice personnel. The first meeting is not intake. The first meeting is education. You can request a hospice consult just to find out more about the service and to find out if your person is even going to qualify for hospice services. We encourage you to meet with a hospice provider. Again, one of the most challenging aspects of having these conversations is making sure that people end up on the same page and that everyone feels heard and that the team is headed in the same direction. It's important to make that decision collectively in an environment of respect and care. If you feel yourself getting heated during the conversation or during the process, other people will be as well. So remembering to take a pause and really reconnect with each other around this person's needs. Hospice in and of itself can be a difficult word for many people. If you have lost a loved one or are considering hospice, our thoughts are with you. If you have additional questions or would like any support, please don't hesitate to call. We're standing by. Thank you for watching and take good care.